If you suffer from knee pain due to joint inflammation, also known as osteoarthritis, this medication may be helpful for you. It is typically used when other treatments like acetaminophen, exercise, or physical therapy have not provided relief. Hyaluronate Sod, cross-linked syringe mimics a natural substance found in the joints, and it may work by lubricating and cushioning the joint, making movement smoother and reducing pain. It's important to take this medication as prescribed by your healthcare provider for the best results. Before you begin using hyaluronate, make sure to read the patient information leaflet provided by your healthcare professional. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is administered by injection into the affected joint by a healthcare professional, usually once a week. The dosage is determined by your medical condition and how you respond to the treatment. Your doctor may need to remove extra fluid from the joint before injecting the medication. Avoid using skin disinfectants containing ammonium salts to prepare the injection site, and make sure the medication is not injected into a vein or artery, as it may cause increased side effects. After receiving the injection, avoid activities that put stress on your knee for 48 hours. You may also experience increased pain and swelling in the knee at first, but if it continues or worsens, talk to your doctor immediately. It's important to stick to the injection schedule as it may take up to 3 injections before you experience the full benefits of this medication. If your condition persists or worsens, be sure to inform your doctor. It's important to be aware of the potential side effects of using hyaluronate sod, cross-linked syringe. Some common side effects include pain, swelling, redness, warmth, bruising at the injection site, or headache. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of potential side effects. While many people using this medication do not experience serious side effects, it's important to contact your doctor immediately if you experience back pain, severe headache, fast or pounding heartbeat, fever, or tingling skin. Although rare, a serious allergic reaction to this drug is possible. If you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, and you may also report side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects and report them to Health Canada. Before using hyaluronate, it's important to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. Some brands may also contain inactive ingredients that could cause allergic reactions, so it's essential to talk to your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have had knee joint infections, skin infections or problems in the area around the injection site, or circulation problems in the legs. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using hyaluronate sod, cross-linked syringe, it is important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It is crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is also important to not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's crucial to act quickly and get the necessary help in case of an overdose. When it comes to treating osteoarthritis, there are non-drug options that can help. Exercising, physical therapy, weight loss, draining extra fluid from the knee, and avoiding painful activities are all strategies that can provide relief. These methods can be used in conjunction with hyaluronate sod, cross-linked syringe to help manage the symptoms of osteoarthritis. This medication is typically injected directly into the knee joint and can provide lubrication and cushioning, reducing pain and improving mobility. It is important to follow your healthcare provider's recommendations for the dosage and timing of these injections to get the best results. Always consult with your doctor to determine the best treatment plan for your individual needs. Make sure you take each dose of this medication as directed by your doctor or pharmacist. If you happen to miss a dose, be sure to consult with your healthcare provider to determine the best course of action for your new dosing schedule. This medication is typically administered in a clinical setting by a healthcare professional and is not meant to be stored or used at home. It is used to treat various joint conditions, such as osteoarthritis, and is injected directly into the affected joint. The dosage and frequency of administration will be determined by your healthcare provider based on your individual needs. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.